So my name's Beales. I'm the Director of Service User Involvement at Together.
Anne, can you tell us what the current challenges are for your organisation?
I think there's several. I think the main one is trying to provide good quality services and support for individuals whilst trying to do that cost effectively in an economic climate where winning tenders and ensuring that we got good quality services for less money is proving very, very hard. What our organisation's done is make sure that all the frontline workers and support are maintained, and we've had to look at varying how we do things, the back office functions to deliver that. So that's one challenge. The other challenge is to ensure that people who use our services lead on the transformation of services so they're more cost effective and they're still of good quality, and for service users to lead on the kind of policy development within our organisation and translating the policy from government and so on and so forth into actions and the way we develop and grow as an organisation, as well as ensuring that service users lead their own recovery or their own journey towards well-being. So implementing service user leadership is quite a challenge. Yeah. And the other thing is we've just produced a report around our concerns and fears that peer support can become too over-professionalised. So we're having to model and work within a provider organisation how peer support can function, where service users are supported by other service users and they're quasi-independent within a provider organisation where we've traditionally had practitioners and so on who actually line manage, and the governance of our organisation is not service user led in the majority, but we're making that transition too. So lots of system change, process change, practice change, transformation, worrying about money. It's not an easy time.
I can quite imagine. What help would you like to see available to help you overcome these challenges?
I think the key thing for me is that we're working with a collaboration now with Mind and the Mental Health Provider Forum, National Survivor User Network, to look at developing an infrastructure for peer support that can implement standards. So for me, if the service user movement and service user leadership, service users individually, service user led groups can have an infrastructure that's accessible to offer support around conundrums like, peer support, boundaries, there's lots of conundrums that we face. If there's an infrastructure there that we can tap into and support it, but be supported by it, I think that's critical. So the idea of service user led, service user leadership, people with lived experience leading the way, that needs to be organised and it needs to be funded so that the infrastructure can be created, because it's not even on the starting line. We've got the National Survivor User Network, which is a huge step forward, but we've still got to work so hard on ensuring standards of peer support and standards of service user involvement, so that we're on an equal playing field, really.
Brilliant, thank you. And have you heard anything today that might help or encourage you with any of these challenges?
I think Ian Taylor around procurement was very interesting.
Right.
What he said about that was, even if you understand what you're up against, I think it's better to know what you're up against than not know. Yeah. I think the political analysis that was provided by Professor Fred, and I've forgotten his last name. Robinson, that was it. Was an interesting political analysis. I think Vicky kind of saying that Mind has got that policy development, they're in contact with the government, that's campaign and join together and be a forceful voice was really useful. In fact, all the speakers offered something very much indeed. Understanding clinical commissioning is important. Yeah, there's a variety of things that I heard today that made me realise we could be more effective.
Brilliant, thank you very much.